Doctors of Reddit, what's the creepiest thing you've encountered while on the job? Verifying death is always sad, but my friend tells the funniest story about how creepy his first verification of death was. This is not meant to disrespect anyone. Black humor is a huge part of doctors' coping strategies. He was on a night shift a few weeks into his first job as a qualified doctor and got a call from a ward to say a lady had passed away an unexpected death, hence he hadn't been called about her before and could he come verify and do the paperwork. It's a busy shift with lots of sick people to see first, so he takes several hours to get there. He goes up and they tell him she's in room 8. The door to room 8 is slightly ajar and the room is dark. Now, she was in a side room, but most patients there were in shared bays of 6 beds, so you get into the habit of not turning lights on. In his nervous haste to make sure it didn't look like he was nervous, he slipped into the room armed only with his little pen torch. The window was slightly open and, he swears, the blind rattled against the sill as he crept towards the bed. The tiny circle of light from his torch picking out the rumpled white hospital blanket. Only a very slim rise showing where she lay, as she was a tiny old lady, just skin and bone. Finally, the light plays over her face and he has to bite back a little scream, nearly dropping the torch. For whatever reason, her pose in death is one of a horrified and horrifying snarl, lips drawn back to bare, likely false teeth, the whites of her eyes showing in a fixed blind stare, and both hands up close to her face curled into claws, slightly overlong nails shining grimly in the meager torchlight. Now, to verify a death, the doctor has to listen for heart and breath sounds for 2 minutes while feeling for a pulse, check for pupil reactions and check for no response to pain. He flicked the torch dutifully across her glaring eyes, forcing himself to shuffle close enough to touch first to check for response to pain and then to settle shaking fingers on her throat so close to those furiously grinning teeth, to feel for a pulse, to get his stethoscope under the collar of her gown under the blankets. He has to lean in even closer, almost nose to nose with her now, unable to draw his gaze away from hers, and he has to stand like that for 2 minutes, the seconds crawling away as he stares into that screaming face. He says there's no way he would have heard heart or breath sounds even if she had been alive. All he could hear was his own racing heart in his ears and, on a loop in his head, please don't let her move. Please don't move. Oh dear God, don't move. Saw a lady once who had gotten high on something and chewed off her lips. That's pretty freaking high. Medical student, while on my psych rotation, came across an individual who was a chemistry graduate student. Apparently he had been taking astronomical amounts of ketamine, and he was just continuously disassociated. For the entire time I was on this portion of the rotation, 3 weeks, I never heard him speak a word. 95% of the time we was wrapped up in his sheets like a mummy, and he would just periodically laugh, a crazy soft chuckle, from under his covers if you tried to talk to him. The creepiest laugh I've ever heard. I'll never forget that. I work as a psychotherapist in a hospital system. My definition of creepy is probably quite a bit different from other medical professionals. The one that got to me the most was a patient who came to us after attempting suicide by sawing both his arms off at the forearm with a table saw. His arms were reattached, fairly successfully too, with only limited impairments in mobility. All I could think was how bad it would have to be to live in his head that sawing his arms off seemed better than that. He has since completed suicide. When I was on a rotation during med school, we got a call about a 23-year-old woman who was shot in the head and who was already completely gone, but was reportedly 5 months pregnant, so they were doing CPR until they got her to the hospital to see if the baby was viable. They got her to the ER and did an ultrasound, and turned out baby was full term, and they did a C-section in like under a minute and got the baby out. I don't think it's so incredibly uncommon, but it was pretty surreal to see a baby delivered from a dead person with their brain exposed, and she was pretty close to the same age I was at the time. I was having a PT signing her admissions paperwork. Everything was going normally and she seemed coherent until she looked out her window and asked me, "Did you see that?" I hadn't seen anything, and she said, "A man just jumped off the building." Then she shook her head and mumbled to herself how her mind isn't right anymore. Freaked me the frick out. Now I'm terrified of getting old and having dementia. A woman at the nursing home I worked at had macular degeneration and would think she saw little men on people's heads or doing a jig on the windowsill or something. I had to explain to her that our brains like to make stuff up when our eyes are going and the little men weren't real. Luckily she was still pretty sharp, even at 90 plus, so she understood, but she seemed a little sad. Paramedic checking in. A few years ago I responded to a call for a pregnant female who shot herself. The 911 caller hung up before any more information could be gathered by dispatch. We arrived to find a girl in her early to mid-20s sitting on the bathroom floor, leaning against the front of the bathtub slumped over. She was obviously pregnant, looked to be third trimester to me. She was unresponsive and barely breathing with a rapid carotid pulse. A small revolver was on the floor next to her. We found a single gunshot wound to the center of her very pregnant abdomen. The patient's mother and 4-year-old son were on scene. The mother told us that the patient invited her over for dinner for some company as she had been fighting with the father of her fetus all day long. The mother stated that in the middle of dinner the patient excused herself from the table to use the bathroom. That's when the mother heard a single gunshot. Anyway, the mother told us that the patient was 23 and was almost full term. I can't remember how many weeks, but it was more than 34. With her second pregnancy. To make a long story short, we intubate the patient, establish 2 IVs, carry her down from the second floor to the truck, and haul us to the trauma center. The patient went into cardiac arrest as we were wheeling her into the hospital. CPR was started and an emergency C-section was performed in the air. Both mom and baby died. The bullet went through the baby and through mom's abdominal aorta. Her belly was full of blood. Fricked up cool. Nothing I can say can possibly describe the year I worked in psychiatric intensive care. Creepy isn't the thing that comes to mind when I think back on it, more heartbreaking and horrifying. But creepiness was a part of it, especially evening and night shifts. Naturally, there is always something disturbing about watching someone while they hallucinate. You can tell it is 100% real to them, and something about that makes you believe it, on some level. A lot of stories end with, and of course, I had to look over my shoulder to make sure. You see the emotions it brings out. Here's a couple stories. There was a woman that came in and sat down across the table from me for her admission interview. She had bandages all over her arms and scotch tape over her mouth and ears. She looked very uncomfortable and wouldn't really sit still. When the nurse would ask her a question, she would peel the corner of the tape back and answer, then stick the tape back on really fast. We eventually found out that she saw and felt bugs crawling all over her, and they were trying to get inside her body. The tape was to keep the bugs out. The bandages were because some bugs got in and she had to dig them out. She couldn't sit still because she felt the bugs all over her even while we sat and talked. The worst part was, she had some idea that it was her mind playing tricks on her. Can you imagine going through your life, feeling like someone is continuously dumping buckets of cockroaches on your head? Feeling like they're all over you and getting inside of you to the point that you're digging chunks out of your flesh in a panic, all while knowing intellectually that none of it is real? Another story. A girl spent my entire 8-hour shift fist fighting the same ghost. She would throw a few punches, and obviously landed knockout blows, so she'd bend over and twist her hand around like she was wrapping some long hair around her wrist. She'd drag her opponent down the hallway, give a few good kicks, then set up for a curb stomp. Starts off kinda funny, then gets a little disturbing when you think about the graphic things going on in her mind, then just sad after you watch this replay for hours on end. As a tech in Psych years ago, there was a 7-year-old kid sent to the floor because the mom didn't know what to do with him. Sadly common thing to happen, even if the kids don't have psych issues. Anyway, the mom was shaking and crying, and they had to take the kid into another room. She was genuinely afraid of her own son. She had suspected something was wrong when she kept finding mutilated animals in the backyard, but never heard or saw coyotes or anything around. The neighbor's smaller pets started disappearing. The boy had an obsession with knives, hiding them around the house, denying anything when the mom confronted him. Then when the two started getting into arguments, he would get really violent and hit her, push her down and kick her, threatened to kill her. On multiple occasions she woke up in the middle of the night with him standing beside her bed, staring her in the face. She put extra locks on her bedroom door to feel safe while they slept. The last straw was when she lifted up his mattress and found 50+ knives of all shapes and sizes under there. So she brought him to us. I remember talking to him, treating him like he was just any other kid that came through. He seemed remarkably normal, until you spoke directly to him. He had this way of looking right through you, or maybe like he didn't see you at all while you were speaking. He would respond like a robot, like he was just saying words because that's what we wanted to hear. And B would always put on this creepy, dead looking smile, like all mouth and no eye involvement in the smile. Especially when he would get away with something, like taking another kid's markers and they couldn't figure it out. Still gives me chills laying here thinking about him. I believe I met a 7-year-old psychopath. Whenever you admit a patient you have to inquire about their DNR status in case of a code being called. I had one elderly patient, late 80s early 90s, who was severely demented and chronically ill, in and out of the hospital every month barely holding on to life. Basically a horrible miserable quality of life. I asked the patient's family about their DNR status. You don't want to put someone through a brutal resuscitation that may not even work if it isn't something that they would want if they wanted to die naturally. She flat out stated that we want everything done for him because we really need his check. I didn't understand at first, but apparently the family was living off of his social security and could not have cared less about his pain and suffering or his wishes. I'm pretty sure it was the creepiest thing I've seen. These people were supposed to be his loved ones taking care of him and they were using him like an inhuman object. A nurse here was doing CPR on a lady whose heart had stopped. They initially rolled her into the room unconscious and not breathing. This lady is pretty much dead. However, in the middle of doing chest compressions, her hands reach up and grasp my wrists and then fall back to hanging off the table. We never got her back. My mother was a NICU nurse for 30 years and one time she showed me a picture of a baby maybe a cm or two smaller than a dollar bill placed next to it. She told me it didn't survive too much longer. That job wrecked her. I remember her coming home some nights and just pouring wine immediately. I'm also never going to forget when she told me with tears in her eyes, if you're very unlucky you will lose a child in your life. I lose one every month. Motorcycle driver, accident, 3rd degree burns, arrived DOA. Had to transfer him from ambulance gurney to a bed. As we were moving him with a transfer sheet, the liquefied cooked subcutaneous fat caused the charred skin on his back to separate and his body slipped onto the floor, despite several of us trying to catch him. Working the night shift as medical on call. I'll explain that I'm easily startled. It's around 3 AM, and I'm back on a ward where I started my night to see how an unwell patient from the start of my shift is getting on. I have a chat with the nurses at the desk. They tell me he's much better, and most recent obs are improved, but that his chart is on the end of his bed. No problem. I trot off to the bedside. In I go. Pull the curtains round and, to not wake the other sleeping patients in the bay, I use my torch to check his chart. All looks good and I'm happy. I turn around, and suddenly in the dark I'm toe to toe with a hunched over old man, who has obviously noiselessly crept in behind me. Well, I just about have a heart attack of my own right there. I jump back, scream, and knock over a drip stand. He starts to yell, and the nurses come running. Someone wheeling the crash trolley. Oh doctor, that's just Albert. He likes to have a wander at night. Yeah, well frick Albert. Friend used to share stories of when she was newly a nurse. She was checking out a patient, following protocol. This guy had been seen multiple times and given an antibiotic for a lung infection. Again, this guy had been seen by a nurse and doctor and she was to do the last follow-up before releasing him. What is this? A shirt. I keep them in my hole. Dude had an abscess so big that he stuffed a t-shirt in it and forgot about it. At the time it had gotten so large that he now stuffed 3 shirts in. Neglected to tell the doctor or get it checked out. By the time the last puss and blood-soaked one was pulled out, the smell was so bad it cleared the room. Not a doctor, but I'm a nurse that works in an intensive care unit. I took care of a patient who had a history of esophageal cancer. A while back, he had surgery, got better and eventually went home. Months later, he got pneumonia and came back to the hospital in respiratory distress. He had to be put on a mechanical ventilator. He was stable, no blood pressure issues. Heart rhythm looked great, breathing wasn't terrible, responsive and following commands. All of a sudden, his blood pressure suddenly drops and he lost his pulse. We called a code blue and began CPR. We brought him back after an hour and continued to run tests to figure out why he crashed. None of the results of the labs or imaging were remarkable. 15 minutes after we had brought him back, his blood pressure drops again and he lost pulse. We continued coding him for another hour until it was clear he couldn't be brought back. The doctor pronounced him dead. His wife came in after the fact. She told me she couldn't stop thinking about the conversation her and her husband had. Wife: honey, don't forget you've got an appointment with the home health nurse this Saturday. Husband: well, I won't be here this Saturday. Wife: what do you mean you won't be here this Saturday? Where are you going? Husband: I don't know. I just won't be here. This conversation happened Wednesday. He was admitted to the hospital Thursday and he died Friday at 11:30 p.m. Not a MD, but I do work at a hospital. I was sitting a patient up at the edge of the bed as in NICU when she started getting all squirrely. She didn't speak much English but kept saying stand, stand, so I helped her stand up. After standing for a few seconds, something told me to lay her back down. Before her head ever hit the pillow, her eyes rolled back and she was gone. She had a massive stroke and was gone on the spot. She all but died in my arms. But I like to think I honored her last wish of wanting to stand. On a medical school rotation in psychiatry, I rotated at a hospital which is essentially a full-time psych ward for folks who have pleaded insanity or ended up in an acute psych hospital and were eventually transferred here because they could not become well enough to get home. The place was actually very nice. It was nothing like you see on TV. It was essentially like a college dorm with 6 or 8 wings total. Each wing had like 16 rooms and each wing was broken down by gender. Each wing also had a gated outdoor area and a gym area, so the patients had a relatively good life considering. Met many patients with many crazy stories, but one always will stand out. This young guy, about 25 years old, was there. He had had these delusions just after college about some girl he had a crush on from his freshman year of college. She wrote for a popular magazine and he supposedly had these delusions that she was writing about him to make fun of him. He hunted her down in her hometown, arped her, and tried to kill her, but she escaped. He then pleaded insanity and was placed here. I went up and talked to him as a little third-year med student. I started asking about his delusions and whatnot. It turns out his father was high up in an international corporation and worth millions. The kid, who was hauntingly normal on the surface and incredibly creepy once you started digging, told me that he basically pleaded insanity only because his lawyer said to. He never had delusions, never had hallucinations, nothing. He basically thought the girl was hot in college, drove 400 miles to repay her, then freaked out. But his lawyers advised he plead insanity because as a soft upper class kid he'd do much better in the psych hospital than in prison. So there he was. Luckily, he'll likely spend longer in there than he would have in prison because generally that's how it works. But he seriously creeped me the frick out. You have been visited by the hamster of joy. Comment: I like chicken to live a happy and full of joy like the joy hamster life. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video, or don't. Either way, have a great day, you magnificent people.